Distinguished guests, ladies and gentlemen, good afternoon and good evening. Welcome to join us here for the Traditional Medicine Forum organized by the World Federation of Acupuncture Moxibustion Societies and our Belt and Road International Education and Training Evaluation Center in Philippine Qihua TCM Institute. I am Ms. Yang Yuyang, Executive Vice Secretary General of WOFAS, today's chair. First, please allow me to introduce the guests and the speakers today. They are Professor Liang Fanrong, Vice President of World Federation of Acupuncture Moxibustion Societies. Welcome. Professor Ma Ying, Secretary General of WOFAS, and other WOFAS officials who will attend this forum. And also we had the director, Dr. Zheng Qiming, from Philippine TCM and Acupuncture Association and Qihua TCM Institute. And we are honored also invite today's keynote speaker, Dr. Li Guangxi, Director of Pulmonary and Critical Care Medicine, Guang'anmen Hospital, China Academy of Chinese Medical Sciences. Welcome all of you. And now, let's invite Professor Liang Fanrong, Vice President of WOFAS, to give an opening address, please.
好，谢谢。尊敬的宝林乌比亚阁下，尊敬的郑会长，各位嘉宾朋友们，大家晚上好。
Your Excellency Dr. Pauline Ubiao, Dr. Zheng Qiming, distinguished guests and friends, hello.
今天，一带一路中医针灸国际教育培训中心传统医学论坛在线上召开。我受刘宝元主席委托，仅代表世界针灸学会联合会，向参会的中非两国嘉宾、各位专家和来自菲律宾传统医药界的同仁们表示热烈的欢迎和衷心的感谢，对论坛的召开表示热烈的祝贺。
Today we hold online the Traditional Medicine Forum of WOFAS, the Belt and Road International Education and Training Evaluation Center of Acupuncture Moxibustion of Traditional Chinese Medicine. On behalf of Dr. Liu Baoyan, I would like to extend my warm welcome and heartfelt thanks to the guests, experts, and colleagues of traditional medicine from China and Philippines. Congratulations on the convening of the forum.
16世纪70年代，中医随华侨移民传入菲律宾，在当地华侨的不断努力下，中药及针灸的运用和推广逐步得到发展。
In the 1570s, the traditional Chinese medicine was introduced into the Philippines by Chinese immigrants. And with the continuous efforts of the overseas Chinese, the application of traditional Chinese medicine and acupuncture have gradually promoted.
1993年，针灸疗法被纳入菲律宾医保体系。2020年，中医药在抗击新冠肺炎疫情中发挥了独特作用，让菲律宾卫生主管部门重新认识了这门传统医药科学。
In 1993, acupuncture and moxibustion therapy was incorporated into the Philippine medical insurance system. In 2020, TCM's unique role in combating COVID-19 was recognized by the Philippines health authorities.
同年11月，菲律宾卫生部批准了中医师职业标准，这离不开世界针联执委曾启明博士为代表的菲律宾中医同仁们的不懈努力，在此我向他们致以崇高的敬意。
In November of the same year, the Philippine Department of Health approved the practice standard of traditional Chinese medicine practitioners. This is the result of the unremitting efforts of Philippine TCM practitioners represented by Dr. Zheng Qiming, EC member of WOFAS. Please allow me to pay my great respect to them.
一带一路创意为东南亚各国之间的中医药交流带来机遇。加之中非地理位置相近，有大量华侨，这些都为菲律宾中医发展和人才培养提供了基础。
The Belt and Road Initiative has made the exchanges of TCM among Southeast Asian countries more convenient. China and the Philippines are geographically close, with a large number of overseas Chinese in the Philippines. These compose the foundation for the development and personnel training of TCM in the Philippines.
为了培养高水平的国际人才，促进中医针灸文化传播，争取菲律宾主流医学对中医针灸的进一步认可，接受“一带一路”平台。去年，世界针联“一带一路”中医针灸国际教育培训中心正式挂牌，标志着针灸走向世界的步伐又迈出了关键的一步。
In order to cultivate high-level international talents, promote the acupuncture moxibustion culture, and strive for the Philippines' further recognition of TCM acupuncture moxibustion, with the help of the Belt and Road Initiative, WFA's the Belt and Road International Education and Training Evaluation Center of Acupuncture Moxibustion of Traditional Chinese Medicine, was established last year, marking another important step of the internationalization of acupuncture moxibustion.
世界针灸联合会现有来自70个国家和250多个团体会员，成立34年来，始终致力于促进国际针灸界之间的了解与合作，通过国际学术交流、培训考试、标准制定等手段，不断提高针灸医学在世界卫生保健中的地位和作用，在全球建立了16个国际教育培训基地和1个培训评估中心，不断为各国培养高水平人才。
WFAS now has more than 250 member societies from 70 countries. Since its establishment 34 years ago, it has always been committed to promoting understanding and cooperation within the international acupuncture moxibustion community, continuously improving its status and role in the world health system through international academic exchanges, training and examination, standardization, etc. WFAS has established 16 international education bases and 1 training and evaluation center around the world to train high-level talents for different countries and improve the overall level and quality of TCM practitioners.
今天是世界针联成立的日子，为进一步加强与菲律宾西方中医学院的合作，推进评估中心建设，我们双方将共同签署谅解备忘录，希望在我们的共同努力下，不断提高菲律宾中医药针灸人才的培养水平。
Today is the day of the anniversary of WFAS. In order to further strengthen cooperation with the Philippine Qihua TCM Institute and advance the construction of the evaluation center, we will jointly sign a memorandum of understanding. We hope that with our efforts, we will continuously improve the training of TCM acupuncture moxibustion talents in the Philippines.
世界针灸联合会将大力支持中心的培训课程策划、授课、教材编写等，支持和开发适合当地的中医针灸培训教育体系，做好宣传推广，推动考试评估结果与当地职业资格和职业水平认定接轨，更好地使中医针灸深度融入菲律宾卫生保健体系。
WFAS will strongly support the course planning, teaching, and textbook compilation of the center, support the development of a local training and education system for TCM acupuncture moxibustion, pay good attention to the publicity and promotion, explore to promote the integration of the examination and evaluation results with the recognition of local qualification and occupation level, and push forward the integration of TCM acupuncture moxibustion of the Philippine healthcare system.
最后，衷心祝愿本次论坛取得圆满成功，祝愿中心蓬勃发展。谢谢大家 ，Thank you very much.
Finally, I sincerely wish this forum a complete success and the center prosperous future. Thank you.
Thank you, Professor Liang Fanrong. Thank you so much. Now, please welcome Dr. Pauline Jose Ubio, former Secretary of Health, Department of Health of the Philippines, to give a welcome address. Welcome, please.
Good afternoon, everyone. This is Dr. Pauline Jean Rosel Ubial, former Health Secretary of the DOH here in the Philippines, and now a professor of the Philippine Siwang TCM Institute. I believe in the power of acupuncture to treat and to cure people. That's why I join you in this year's celebration of the World Acupuncture Week, starting from November 16 to 22, 2021. I would like to congratulate the organizers of this forum today, the World Federation of Acupuncture and Moxibustion Societies, headed by the President, Professor Lui Buang Yan, and the Vice President, Professor Liang Fanrong, and the Secretary General, Professor Ma Ying. And of course, I'd also like to greet the founder and president of the Philippine Siwang TCM Institute, who has been the champion for TCM here in the Philippines, Dr. Kiming Singh. And I would like to greet all the delegates and participants in this year's conference and celebration of World Acupuncture Week. Acupuncture is really a very effective and very cost-effective strategy and medical treatment to many of our countrymen. And I myself am an acupuncture patient, and I believe in its usefulness and the need to integrate TCM and alternative healthcare towards our goal and achievement of universal healthcare here in the Philippines and throughout the world. Other modalities like Qigong, the herbal medicines, Chinese herbal medicines, the Ayurveda, yoga, and other alternative medicines is important to provide quality health care to people regardless of capacity to pay. So that's our definition of universal health care. And the introduction of alternative health care modalities is important so that everybody, all Filipinos and all people of the world have options so that they can choose which modality, which treatment is suited for them. So with that, congratulations to the organizers, the World Federation of Acupuncture and Moxibustion Societies, and of course the TCM universities and institutes. Congratulations to all of you, and happy World Acupuncture Week.
Thank you so much. Thank you, Dr. Jose Ubio. Now let's invite Dr. Zheng Qiming to give a speech. Dr. Zheng Qiming is the Executive Committee member of WOFAS, Director of WOFAS the Belt and Road International Education and Training Center of Acupuncture Moxibustion of Traditional Chinese Medicine in Philippines, and also the president of Philippine TCM and Acupuncture Association. Now, please, Dr. Zheng, give us the speech. Please turn on your microphone. Dr. Zheng.
Yes.
Okay, thank you.
Thank you very much. Thank you, Miss Yang. Thank you. First of all, I would like to share with you, this week is the World Acupuncture Week. We gather together to celebrate the World Acupuncture Week. It starts November 16 to November 22. As we know, this month is the traditional medicine month in the Philippines. So as the executive member of World Federation of Acupuncture and Motion Societies. So the Qi Huang TCM Institute, with the UFAS, has established the collaborating program for training in and evaluation last November of 2020. So we signed the MOU for the program, and this program will become our Philippine TCM and Acupuncture Association continuing education program. So here, I would like to say thank you to all of my colleagues in the Philippines, for the Dr. Liu Shenlong, Dr. Eddie Concepcion, and Dr. Cai Yating, with the Dr. Philip Tangatue and Dr. Fatima Lau, and all of your practitioners, all of your effort. So we're able to work together to promote and develop TCM and acupuncture in the Philippines. In here, I believe this collaboration with the World Federation of Acupuncture and Motion Societies, we are able to provide the expert lectures for this forum. And these programs, I believe, going to support the Philippine TCM and acupuncture, all of our practitioners, and continue education. So this is program not only for our members of Philippine TCM and Acupuncture Association, but also it will benefit to all of our practitioners in the Philippines. So UFAS, as the under the WHO NGO organization, and is the liaison organization of ISOTC 249. So I'm very honored tonight to work with the UFAS, all of the leaders and experts. And we're able to honor to invite our famous doctors from Kwang Hospital to share us his rich experience. And Kwang Hospital is under the China Academy of Chinese Medical Science. So this is the good opportunity to work with us and give us some idea for this particular pandemic situation in Philippines. So I would like to say thank you to everybody, your support. Whatever you are coming from, what TCM institutes. So all of us in the future and very near future will work together to promote academic acupuncture and TCM in the Philippines. Thank you very much. for attending tonight and your time. Thank you very much.
Okay, thank you, Dr. Zheng. As you mentioned in the speeches of our guests, WOFAS and the Philippine Qihua TCM Institute collaboratively established the WOFAS Belt and Road International Education and Training Center of TCM last year. So next, in order to deepen cooperation to further build the center, our two parties will sign MOU. Welcome to the signature ceremony, everybody. Now, in order to deepen cooperation to further build the center, today two parties will sign the MOU. I hereby coordinately invite you all to join us. First, and we'd like to introduce all the participants from our WOFA side. President Professor Liu Baoyan, President of WFAS. Welcome. Secretary General Professor Ma Ying. Welcome. And the executive members Professor Yang Longhui, Yu Xiaochun, and Professor Huang Longxiang. Executive Vice Secretary General Professor Yin Haibo. That's all from our Chinese side. And from Philippine side, please let Dr. Zheng Qiming introduce for us. Thank you.
Hi, good evening. Good afternoon, everyone. Thank you, everybody. Philippine Qihua TCM Institutes. We have the all of the colleagues here and all of our member students participating for this afternoon MOU program. Attending this afternoon, yes, I'm the Dr. Qiming Zheng, and this is the Dr. Chaya team, is our academic team of the institute, and online is our faculty team, is Dr. Philip Tangatuel. And all of our participants are our students to attend. Thank you, everybody.
Okay, thank you so much. Now we'd like to invite Professor Liu Baoyan and Dr. Zheng Qiming sign the MOU at the same time. Welcome. And the other VIPs will be the witness guests. Thank you.
Yes. Okay, good.
Okay, please show the documents simultaneously. Thank you. Okay, congratulations for both of us. Thank you so much.
Yes, I'm around. Hello.
Hi.
Hi.
Good afternoon. Thank you for to participate for this MOU. Thank you very much for your time.
Thank you.
Okay. Okay. This is from the WFAS, World Federation of Acupuncture and Motivation Societies. Attending for today is the president of WFAS, Professor Liu Baoyan.
Hello.
Yeah, thank you, everybody. Yeah, 其实我们再把这个合同，把这个备忘录再拿一下，给大家见证一下。This is we signed our MOU, which is the Philippine Qihua TCM Institute, which is the World Federation of Acupuncture and Motivation Societies. Now we are work together to promote the traditional Chinese medicine and acupuncture program to provide the training and evaluation for practitioners. So we wish by your support under the PTAC of DOH to work together.
Okay.
Thank you very much. Thank you.
Thank you. Thank you for
Okay,
support.
thank you.
Dr. Annabelle, would you like to say something?
Yes, I would like to thank Dr. Kim Singh and all our wonderful guests. Thank you so much for trusting PTAC and the Philippines for carrying out your advocacy. And PTAC will support and help you in this endeavor. Thank you very much.
Thank you.
Thank you. Thank you very much.
Yes, I wanted to introduce Dr. Lee Guangxi. Dr. Lee Guangxi is the Professor of Medicine, Director of the Pulmonary and Critical Care Medicine, Guang'an Hospital, China Academy of Chinese Medical Science. He's also the Assistant Professor of Medicine, Pulmonary and Critical Care Medicine, Mayo Clinic, Mayo Epidemiology, and Translational Research in Intensive Care, ICU. And he's also the member of the expert group led by China State's Council for Joint Prevention and Control of COVID-19 pandemic. So Dr. Lee Guangxi has been engaged in clinical scientific research and teaching for many years. He has rich clinical experience in the diagnosis and treatment of common, serious, and critical respiratory disease with integrated traditional Chinese and Western medicine. He's good at the treatment of chronic obstructive pulmonary disease, bronchial asthma, chronic cough, bronchiectasis, sleep apnea, and so on. Today he is going to give us the lecture title is Protecting Vulnerable Population from Acute Lungs Injuries and COVID-19 TCM Treatment. Let us welcome Dr. Lee Guangxi share us his experience. Thank you very much and research.
Hello, everyone. Today, my topic is about the protecting vulnerable population from acute lung injury in COVID-19 patients. So when we talk about the COVID-19, so maybe everyone is very familiar, this new pandemic disease, and it killed quite a lot of people all over the world. So my topic is about how we use Chinese medicine to protect patients from acute lung injury and from the death. My name is Guangxi Li, and I'm from China Academy of Chinese Medical Science, Guang'an Hospital. So these are my major topic. First, I want to discuss some about the symptoms of COVID-19. Second, we will talk about the treatment of COVID-19. And third, we will talk about the case of treatment COVID-19. Finally, and we will do some summary. And maybe if you have any questions, we would like to take some simple questions and give you some answers. So the first, when we talk about the symptoms of COVID-19, we maybe have some problem with, so why patients have COVID-19, how they got COVID-19, and how severe the COVID-19 once they got this disease. So usually, the major clinical manifestations, they include fever, fatigue, and dry coughing. So especially the fever. So almost, the very severe COVID-19 patients, they all had fever and very high fever. Maybe lasted maybe 4 to 7 days. So that's very dangerous, situation. But for the most patients, they may not have such high fever, especially for the young kids and for the very healthy young adults. They don't have any symptoms. They may only have very mild fever or even no fever. They may have some kind of dry cough, but some may not. So it just depends on how strong you are. So if you are very strong and you don't have any baseline conditions, then you will not have any symptoms. But if you have some comorbidities at baseline, then once you got COVID-19, you may have very severe symptoms. These symptoms include that what I have said, fever, fatigue, and dry coughing. That's a slowly progress. So initially, the patients have the fever, and later they may have very strong fatigue feeling, and then they start to have dry cough, and then they start to some kind of chest pain, or they don't shortness of breath, or they cannot walk, they must be on the ventilator. So that's a very severe sign of the disease. So the less common manifestations include stuffy nose, runny nose, pharyngia, and diarrhea. So that's some patients, they may have a symptom like that. So about 10% of the patients, they will develop dyspnea and hypoxemia after 1 week fever. For those cases, we call that very severe cases. So regarding the mild cases, we don't care, because in the Western world, we all know that some young adults, they don't care about the COVID-19. Why? Because they are very young and they are very strong. So they don't care about the outcome. So they will not have any severe manifestations. But in severe cases, they can rapidly progress to ARDS, septic shock, metabolic acidosis, and hard to correct. They may have increased blood viscosity and coagulation dysfunction. So that's the reason why we call the COVID-19 the silent killer, because they do not kill everyone. They just kill the patients who is not very strong. So that's a vulnerable population. So one of the most notable features of COVID-19 is that it goes unnoticed for a remarkably prolonged period of time. So that during that time window, the patients may only have fever and fatigue. And suddenly they start to develop hypoxemia and they die from that. So that's the reason why we need to take those patients to the hospital, to the emergency room, and give the oxygen support, and then maybe they need some ventilator support, or they may need ECMO. So they must end in the intensive care unit. So that's a very dangerous situation. So how we define the vulnerable population for acute lung injury? According to our data, we have seen most patients who develop a very severe type of COVID-19, they are male, they are overweight, they had diabetes, and they had some baseline comorbidities like hypertension, like cancer, and some other interstitial lung disease and other disease at baseline. But according to Chinese medicine theory, these people, they all belong to Qi deficiency category. So once the patients have some Qi deficiency, so they cannot expel the virus out. So the virus can kill the people. That's our data showed. We noticed that for the mild cases, the overweight population only 32%. But for the moderate cases, the overweight population is about 47%. For the severe cases, we noticed that the overweight almost reached the 70%. So if you are overweight, then you are very dangerous. Why you are overweight? Because in Chinese medicine, the spleen Qi deficiency cause you're overweight. So look at the whole period of the patients. The incubation period is about 1 to 14 days. But right now, with the Delta variant, we notice that maybe the incubation period is shorter and shorter. But mostly it's about 3 to 7 days. So that means you catch the COVID-19, but you don't develop any symptoms. But later on, you start to have some kind of fever. So that's we call that day one. Once you have fever, you get the COVID-19. So that's the reason why we always measure the patient's temperature, because we want to make sure you don't have any possibility to get the COVID-19. So the fever period is usually last about 7 days. So that's a very important time window to prevent acute lung injury. That's day 1 to day 7, especially if you control the patient temperature within 48 hours, then the patients will have no problem. So they can discharge home or they can go back home very easily. But if you cannot control the patient's fever within 7 days, they may start to have some kind of dyspnea, and they may have, hypoxemia. That's very dangerous. So that's because you have delayed treatment and prolonged fever, then they start to trigger acute lung injury. So that we call that they trigger the cytokine storm, and the cytokine storm will kill the people. So not the virus kill you, it's because the cytokine storm. After once you have the acute lung injury period, and then you must go to the emergency room or intensive care to get some kind of ventilatory support, oxygen support. Then after 7 days, you'll start to have a recovery. You start to recover from this very severe situation. During that acute lung injury period window, why you have such low oxygen? Why? Because your alveolar level was damaged by your cytokine storm. So the cytokine storm can trigger the alveolar flooding. So that means a lot of water in your alveolar that you cannot have the oxygen go into your blood. So that's a problem. So after you get some treatment, after you get the ventilatory support, and then the water was dispelled, and then you start to go to the recovery period, that at least you will need another 2 weeks to recover from this very severe situation. So this picture exactly tell you how the COVID-19 patients progress to the acute respiratory failure and fall into the ICU, and why they die from this disease. So initially, you only have high temperature, but you cannot control the temperature. Then your temperature start go higher and higher, and you start to have the very dry cough. The frequency of dry cough will increase, and then you start to have the dyspnea. And this time, you need to measure your blood oxygen. So that's you need to, pulse oximeter will be usually used to measure that level. So SpO2 need to be at least 90%, then you are safe. But once it reach less than 90%, you are very dangerous. So what we, the Western physicians, like the emergency physician, intensive care doctors, they only want to see your oxygen level. So then they will decide if you need to take to the hospital, take to the emergency room, or into the intensive care unit. So if you get recovery during this very initial period, then you will end up in this level. It's very safe. But if you need to be on the ventilator, if you really develop respiratory failure, acute lung injury, and ARDS, then you need to be into the ICU. So that's the reason you go this curve. As here, you will go to the ICU, and later on, you will be transferred to the ICU unit on the ventilator and ECMO, and then you probably will die. They will have very high chance to die from COVID-19. So that's how we look at the whole picture of the COVID-19 patients. So in the home isolation period, what you need to notice is you need to make the patient don't have fever, right away. And if you cannot control the patient's fever, then you must call the physicians to take them to the emergency room or hospital ward. And if they cannot recover from that period of time, then the patient start to have the ARDS, and then you need to go to the ICU. So the mechanism under this whole picture is another picture. So why the patients start to have the respiratory failure? It's not because the viral response. So I just mentioned that. It's not the virus kill you. It's because of your host inflammatory response. So when we talk about the antiviral drug, we only need that drug within the 48 hours in the time window. So that's what I have published paper before. So we want to see if some antiviral drug really help people to prevent acute lung injury from the seasonal influenza. Like a seasonal influenza, we also need to kill the viral at the initial stage. But at a very early stage, early infection, if you cannot control the viral, and then your host inflammatory response start to have. So this will trigger the cytokine storm. And you may not regulate your host inflammatory response very well. So sometime it will become very high inflammatory response. So that's called a cytokine storm. We call that cytokine storm. That's a major mechanism why you get ARDS and SIRS and shock and cardiac failure. Here is a whole picture of the mechanism. So what we want to do, the potential therapy is talking about some, the early use of antiviral drugs. So how we control this pandemic disease? Like in China, we had a very mature experience. So that's first, we want to control the transmission. So that's mostly efficiency. So we don't want the whole population get the COVID-19. Then we cannot have enough healthcare resources to take care of these patients. So that's why we lost a lot of patients' life. It's because the whole population just get this COVID-19 at the same time. Then our healthcare resource will be occupied. Then we don't have enough oxygen, ventilator support to help the patients to get that, to safely transit to the stage. Like what I said, you need at least 1 to 2 weeks to recover from the acute lung injury. So that's how we control this pandemic. We want to test to isolate the patients who got COVID-19. So that's right now most countries how they control this transmission. And the second method is to do the lockdown. So when we lock down the whole city, we can protect the vulnerable population, and we can stop the transmission chain in the whole cities. But certainly you will have a lot of the problems, you make people not move freely, and they lost freedom to do work, and they can only work at home, to do remotely, to do some remote work. The most important, especially Chinese medicine, we want to treat the patients at an early stage. The first, we want to leverage patients according to the different disease level. So we want to make sure the patient is in the initial stage, or in the second week of the disease, or in the, already they fall into the acute lung injury stage. So then you need to make sure the patients need what kind of care. So regarding the fever window, so the fever window, this is the transmission stage. During that stage, we try different methods. Right now, we don't have any really working very well antiviral drugs. So if you use this window, the patients will have high fever, and the high fever will persist for quite a long time. And after the 1 week of high fever, the patients will have the fall off the cliff right after the fever storm. We have tried steroids. We have tried NSAID medicine, like a paracetamol, like some other NSAID drug, but it doesn't work. So the best solution is Chinese medicine. So we successfully rescue quite a lot of patients using Chinese medicine to stop the fever. Now let's go to how we use Chinese medicine to treat these patients. So what I have tried is this medicine. We use ginseng, the detoxification drug, to help people, recover from the acute lung injury. So what kind of the medication we need to think? It's like based on the Chinese medicine theory. So like what I initially discussed with you. So once the patients got the COVID-19, so at the early stage, nobody know who will fall into the severe situation. But one thing we need to make sure, that's vulnerable population, they all fall into the category of qi deficiency. So once you have potential qi deficiency problem, then you may have the very severe type of COVID-19. So that's the reason we need to boost your qi. Like, right now when we talk about how we control the transmission, we all talk about the vaccination. So we use boost your antibody level. So the same thing in Chinese medicine, we need to boost your qi to defeat this virus, to regulate your immune response to this new virus. So once we have the ginseng inside of your body, then they boost your qi and make your qi strong, and then they can expel the virus out. Then we use some other medications, other herbs to help this, to make you sweat. So once you have sweat, then your fever will become normal. So it's different from the NSAID medication. When you use the Chinese medicine to reduce fever, the fever will not rebound. And also, once you use the Chinese medicine, ginseng, everyone knows they help us to improve fatigue feeling. So once we get this medication, we also don't have the fatigue. If it's not available in your country, you may use, the paracetamol plus ginseng to help you to have the same function. You may try that. So here, the major key role is the ginseng. So how we understand the ginseng, I already discussed. So now we need to think about the ginseng, why the ginseng could help us so much to protect us from getting a very severe type of acute lung injury, because ginseng have very different functions. They have some kind of regulate our immune response to adapt to the new virus. So once we get this new virus, our body don't recognize this new virus. They may think it's very strong viral, and this viral may kill us. So they trigger the cytokine storm. They make our immune response too strong, and then this may kill ourselves. They may kill our own alveolar and our own cells. So then this will cause a lot of problem. But ginseng, the ginseng is different. Ginseng can help us to through this regulate our immune response, and they can change the whole map of our immune response level. So here, that's the reason we think the key role of ginseng is a key mechanism of immunoregulation. That's why we use ginseng to treat COVID-19 patients. Because some people always argue that why we use ginseng, they already had fever. Why we use ginseng? Because we want to tell those people, because you are weak and you are vulnerable and you have qi deficiency. So the first thing we need to use ginseng. And some other physicians may argue that why we don't want to use huang qi. So it also can boost our qi. Huang qi is a little bit different. It's just like the closing the door. So huang qi may only focus on we call that external surface of our body. So surface of our body. So that close the door, close your house door, and then you kill the thief. That's very dangerous. So we don't want to use the huang qi, but we want to use the ginseng to boost our own energy to expel the virus, the evils. When we talk about the ginseng, we need to think about the history of our medicine, to think about the history of our pandemic, how we control our pandemic in the Chinese medicine history. In China, the pandemic influenza almost happen every 6 to 10 years. So quite a lot of very successful treatment was based on different kind of combination of different herbs. One of the most famous formula is Ren Shen Bai Du San. We call that ginseng and menthe formula. It was originally recorded in the prescriptions of the Bureau of Taiping People's Welfare Pharmacy. So this is very famous Chinese medicine books. It was finished in about 1078 to 1110 that years. So the later commentary by Yu Lin and some other famous physicians, they think stating that this formula is the best formula for treating pandemic influenza because it can protect vulnerable population. So why we think about that? This old physician like Dr. Yu Chang, he mentioned that human beings are infected and sickened by 3 evil qis. When one dies of the infection, the evil qis spread. When they contaminate hundreds and thousands of people, the disease became pandemic. 2 or 3 doses of the ginseng detoxification powder a day are capable of ridding the patients of the symptoms. I personally feel it is the most effective medicine for the pandemic influenza. So that's what I mentioned by Dr. Yu Chang. So the ingredients of the powder are all bland, but combined to work magically on the pandemic disease. This is a history map of ginseng and menthe formula. In about 1087 year, there is a very famous book. They start to record this medication. Later on, quite a lot of different Chinese medicine books discuss how we use this formula against the pandemic influenza. When we think about this formula, we want to make sure how and when we should use that. So we should use that at a very early stage, because once the evil goes into your body, go inside your body, this will like a snake. This will will kill you tighter and tighter through this kind of snap you. But if you use it early, as you can escape from this killer very quickly. But if you use it very late, then it will be different story. And then you need increase ginseng doses. And then, once you increase, I will discuss this about a little bit later. But the most important thing is you use it at a very early stage. So now I want to show you some cases of how we use Chinese medicine to treat COVID-19 patients. So here is very successful cases from my treatment. So he is a male, 52 years old, he had diabetes, and he had OSAS. And he was actually on the antiviral and antibiotic and also antiviral drugs for about 8 days. He was also on the steroids for about 8 days. But after all this Western medicine treatment, the fever still increased. It increased from 37.8 Celsius to 39.5 Celsius. And the patient start to have very strong coughing and shortness of breath, and his respiratory rate already reached 32 per minute. So when we do the physical examination, we notice that he was actually on the high flow nasal cannula, and you can see here his FiO2. That means you inhale oxygen level. So right now, like our room air level is about 21%, but the patient actually, he was on 65%, while his oxygen level, pulse oxygen level, is only 81%. For as a normal person, we should be about 97%. So obviously, he is on acute lung injury stage. So it's very dangerous. He needs some kind of ventilatory support. So the physicians think, he should be on the ventilator. He should be ventilated and give some kind of ventilatory support and some other treatment. While we want to use some Chinese herb. So that's what I used. I used the ginseng and Manti formula, and we reduce the fever right after half doses. So he started no fever, and you can see here he still needs some kind of oxygen support, but he was only on 43% oxygen support, and his oxygen level in his blood go back to the 97%. That's a pulse oximeter set. You can see here. So it's much better than before. And here you can see the treatment, the chest X-ray. So when he was on discharge stage, you can see here he had a lot of infiltration in his lung, because the infiltration needs some time to be absorbed. So after 1 month, he was almost fully absorbed this kind of infiltration. I will give another example. So this another patient, this patient had fever and also had desaturation. So this is a patient in Egypt. So he's not Chinese. When I go abroad, so I treat some patients, foreign patients. So these patients start to have fever and had some kind of desaturation. He was in the room air, and his oxygen level go to the 19%. So what we give is only give patients a ginseng and the Manti formula, and the patient fever gone. Also, we give some transdermal therapy treatment. So what is the transdermal therapy? The transdermal therapy is like some kind of cupping, combination of cupping and moxibustion. So that's we use this kind of treatment to suppress patient's cough. So the patients, after this treatment, the patients don't have cough. And I want to talk another cases. So it's also very interesting. So this is a male patient. He's 70 years old, and he had a baseline hypertension. So this patient on day 7, so his fever increased from 37.8 to 39.5, and he started to develop coughing and have shortness of breath. So he's just right at the cliff. He need to go into the emergency room, not the emergency room, sorry. He need to be taken to the intensive care to do some kind of ventilatory support. And his lung, infiltrate start to increase. So the physicians, we had a physician team, and we think the patient need to be transferred to ICU tomorrow. Right before that, I want to do some kind of, treatment. So I gave the patients some ginseng and Manti formula, but I increased the ginseng to 50 grams. So right now, in my previous presentation, it's only 12 grams. But now I give him 50 grams. Right after the drug, what he feeling? The nurse called me. The patients start to have shiver. You can notice that the patients start to have shiver. So they call me at midnight. So why the herb, Chinese herb, should not have any safety issues? Why the patients start to have shiver? But after maybe half an hour shivering, and the patients, the fever recovered, and the patient don't have any problem at the next day. So they all very surprised why he don't have any problem after treatment. So that's a key point. So we increase the qi, increase patient qi, and we expel the virus out. And then once the people's, we call that zheng qi, that the normal qi with the evil qi, when they struggle together, when they hit each other, and then the patients start to have shivering. So that's a turning point of the treatment. So once we give enough ginseng, the patients will recover from the shortness breath just before the fully development of acute lung injury. So we want to do summary of today's topic. So how to survive from the COVID-19? We think the Chinese medicine should be the first line treatment. And right now in China, we almost all use this method. So we use Chinese medicine to reduce the fever, so stop the progress of the disease. So here, why we patients start to have acute lung injury? You need to understand the mechanism. In the right part of your alveolar, you can see you have alveolar membrane broken, and you have alveolar flooding, so that your alveolar full of water, and then the oxygen cannot go into your blood. So that's the reason why you have cough and why you have desaturation. That's the underlying mechanism. So we call that the acute lung injury. But in the normal alveolar, you don't have such problem. You only have the macrophage, alveolar macrophage in your lung, and to help you to kill this outside of the different bacteria and the virus. So will protect you. So that's why we need patients not to have this alveolar flooding and going back to the normal stage. So we cannot use antiviral drug because nothing was confirmed working really well. But even if some kind of antiviral drug really works, and then you need use this drug at the right timing. So that means you need to use this antiviral drug within the 48 hours time window to kill the virus. Steroids is also questionable. So you cannot give the steroids for everyone because it had a lot of adverse reactions. So you cannot do that for every patient. You may only use that for the very severe acute lung injury. Antibiotic only can be used on the co-infection patients. For example, if the patients have the COVID-19, but also have some kind of bacterial infection, then you may use this antibiotic. So the most important thing is using Chinese medicine to control the fever. Also, the NSAIDs did not work really well. So after you take the NSAIDs, the fever starts to become low, but later on it rebound. So that's another big problem, and also damage your liver and damage your other organs. So had a lot of problem. You make your platelets decrease, make your red cell decrease, and this we really need to be very careful. So another very important thing is using our transdermal therapy. Through the transdermal therapy, we can control this alveolar flooding. We can reduce the water in your alveolar. So that's how we use ginseng to boost your energy. And in the basic research, we noticed that ginseng had a lot of different functions, and it may regulate your B cells, CD4 T cells, and some other the TNF-L8 and other L1 L6, some inflammatory mediators. Also, the ginseng can help you to regulate them. So the mechanism is quite different. So I don't want to discuss too much today. And transdermal therapy, you need to use that on the very specific, acupoint, like we call this Fei Shu acupoint and Ge Shu acupoint. So using this zone, we can help the patients to reduce the cough. Why the patients have cough? Just now I mentioned that it's just because your membrane your alveolar membrane broken, and your alveolar membrane inside your alveolar level, inside your alveolar, there's quite a lot of water. So we call that alveolar flooding. So in the ICU, for the severe cases of acute lung injury, we all use a prong position ventilation strategy. So we make sure the patient, was on his abdominal position. So he lay there. You see, we all lay the patient's, abdominal position. Then, we call that prong position. And during that time, so the patients may have the ventilatory support, or they may have the only on the HFNC. You can see the patients. So these are intensive care patients, and we give them this transdermal therapy, and to help them to reduce the alveolar flooding. So once they get this treatment, they all feel very well, and their oxygen level goes very fast, goes rapidly. So the first thing we want to mention that is identify high-risk population and prevent acute lung injury. So because regarding the younger adults or the kids, they have very strong energy and their qi is very strong. So we don't care too much about them. We only want to care about this elderly population and those who have very bad situation or very bad baseline conditions. So those patients, we need to be really very careful. And we want to early use the ginseng very early. So early use of ginseng, we can protect this vulnerable population. And then if the patients start to have a longer period of fever, and then we must increase the ginseng doses to boost the energy of the patients. And after the fever gone, they may still have some cough. So then we use some, the transdermal therapy or acupuncture or moxibustion. These all help to treat alveolar flooding. Then their cough will be gone, and their desaturation will go back to the normal. And certainly, we want to do some intubation backup. So once all these strategies did not work very well, then we need to take patient to the critical care unit, and we need to intubate the patient to give the ventilatory support. So that's all my topic today. I would be happy to take any questions from you. Thank you.
Thank you very much, Dr. Deng. Actually, we have the great honor to have Dr. Guangxi Li online today. He's now ready to take some questions. So, Dr. Deng, would you like to help with this part?
Yeah, sure. I think I have assigned the job to our members here. Is Miss Kathy Lopez. So yeah. So Miss Kathy Lopez, if you can collect all of the question concerns, or if everyone can raise your hand, so Miss Kathy Lopez can work with you. Before to answer the question from the Dr. Li Guangxi, I would like to say thank you so much of the Dr. Li Guangxi. Thank you. Thank you.
So there's a first question here. A question unanswered. How is ginseng prescribed for the patient? So you have mentioned a 12 gram for a formula, and then you also mentioned a 50 gram. But I think the question of Li Minghan is, what do you suggest? Is how many grams perhaps, and
yes.
How would you take the ginseng?
Yeah, very, very interesting question. So as I did not explain it very well in my slides, but in my clinical experience, like a patient, I just finished one, some treatment for the Chinese patient here. So how we practice here? So for the patient older than 80 years old, so we usually give them 40 grams a day. But for the patient, if they had a fever, we must give them 50. So especially for the elderly population. So that means the patient have Qi deficiency. So that you need to give the patients 50 grams of ginseng a day. So you can divide them by 2 times, or you can divide them by 3 times. But totally, you need to give them 50 grams. So that's very important, because otherwise you don't have enough Qi to help you to expel the virus. Not only the virus, actually it helps you stop the cytokine storm, and then you will not have then what we see the clinical result is the patient, the fever gone, and then he don't have the ARDS and acute lung injury progression. So he may only have some kind of cough, but his desaturation is not so severe. So we can save patient's life with ginseng. Also, we need to use them as early as possible. If we use them too late, after 8 days, after they may already develop full ARDS, then nothing can work really well. So everything need to do something work early instead of late.
Thank you, Dr. Lee. I think that answered the question. So the suggested for more than 80 years old is 40 grams per day to cup. And then there's another question: can we take ginseng for protection? And
yes.
If we can, how much
for the
we take
elderly,
a day?
Yeah. Thank you. So for elderly patient, we would like to ask them to do some ginseng for the protection. Like 10 grams is already good enough. Certainly if you don't have any problem, if you don't have any infection issues, then you may not need to take. You just need to do some exercise, to Tai Chi, Qigong, whatever will help you to boost your energy. That's good enough. But for the really, you think you may have this infection, and especially your age is is older, or you are between the 40 to 60. That's very tough population. Your Qi already decreased, but you don't know if you are really vulnerable or not. So my suggestion is for you should maybe, for this population, 40 to 60, you also need to take some ginseng to help you boost energy. That's my suggestion.
Okay, thank you, Dr. Lee. I think that's clear. And then another question from Dr. Jeffrey. Between ginseng formula and ginseng 5-2 detection, which is more effective in treatment of COVID-19?
Yeah, for me, I usually use the ginseng formula. For the patient who don't have any severe problem, not everyone develops severe type of COVID-19 right after infection. It only after maybe 1 week, then maybe around 10% population will develop severe type. So that's the reason I want to protect this vulnerable population. So I only want to protect those people. Otherwise, it's just like influenza. It doesn't matter. It will not kill you. But for this 10% population, if you don't treat them very well, the patient will die. So you must take care of those population, 10% of the population, very, very carefully. With ginseng at early use, that's a very important point. Nothing really works well. That's my clinical experience.
So Can I also clarify? So you're saying if it's a vulnerable population that's with underlying condition, then you would suggest ginseng instead of Qingfei Paitu decoction?
Yeah. I will only give ginseng and Manta formula. You can check the internet and you know this formula, how the combination. So basically, why we use this ginseng and Manta formula? Not only ginseng, we also use some other Chinese herb to make you sweat. But in Chinese medicine theory, you cannot sweat too much. If you sweat too much, then you will lose your qi. You may give this, the vulnerable population more room to make this virus go into inside your body. So that's we want to use this. We call that the gentle sweating formula, something like that. So that's how we use this. Why we use ginseng and Manta formula and not the Qingfei Paidu decoction for the vulnerable population, because they had a baseline condition, they are elderly, and they have some kind of qi deficiency. We need to be careful, and we need to protect the patient's body qi. Like two people do the boxing game, we don't want to kill the other people right in the first round. We want to do something to keep our energy and to make us live, till the end. So that's a basic idea of this formula.
Okay. From Ailey, but I don't know if it's related to the lecture. So you may, with due respect to Ailey, because the question might not be related to the lecture. So I don't know if Dr. Lee mind, but with due respect, I'd like to skip this because I don't think it's related to the lecture. So I'll move to Zheng Wen na. Aside from ginseng, is there any other Chinese medicine we can take daily for protection, prevention of COVID-19?
Beyond the ginseng, I don't think other thing really works very well. Because if you are very strong, you don't need to care too much about the COVID-19. Because most likely you will only be the COVID-19 carrier, but you will not have any trouble with that. So who cares? Why you need to take some medicine for this, so mild problem? So, but for the vulnerable population, you are really dangerous. So that's the reason why I highly suggest ginseng for the, not only for the treatment, but for the protection, for the early treatment. That's very important. And also, I need to tell you, the ginseng, there are different types of ginseng, but the first one is Korean ginseng, and then the Hongshen, we call that red ginseng, and all these ginseng basically was from the Changbai Mountain. So that's very important. So not the Xiangshen, we call that the American ginseng, that doesn't work very well. So the function is not same.
Sorry, so that's I think a very important information. So this is not American ginseng or Yangsheng. This is Korean ginseng that we are talking
Korean
about.
ginseng is okay. Korean ginseng and Chinese ginseng. So that's a different type of ginseng from the American ginseng. So then you need to know the ginseng. They have the ginseng planted in the Changbai Mountain. They have the different kinds of. They had from the basic research, we noticed that they might have more ingredients to help you to get the acute lung injury. So that's historically we use that to protect the vulnerable population. Not what I said. This ginseng and Manta formula we use it 1,000 years. Not only for this pandemic, for every pandemic we have been using it continuously, consistently. The very important question. So here they say the difference between using ginseng and huangqi. They both to boost the qi, right? Yes, but the problem is huangqi is to close the door, close your skin, basically to close your skin. Then you fight with virus. That's very dangerous because you don't want to close your door to fight with with some some problems. You want to open your door and to push this evil outside of your body. And also in the basic research part, we noticed that ginseng could help you to decrease your chance to get acute lung injury, but Huang Qi could help you, could make you to have more immune response to get acute lung injury. So at the early stage, very importantly, you should not use Huang Qi and you should use ginseng. So you can read many Chinese medicine books. So that means once the evil in your surface, you should expel the evil outside of your body, and you need to use your some kind of qi inside of your body. So that's the reason why we use ginseng instead of Huang Qi. Very important questions. A child who encounter cough can also take ginseng? No. So for the children, we never recommend any children to take the ginseng and manta formula. That's totally different issue. For the young kids, for the children under 18 years old, we never recommend this formula because they usually don't have any symptom. They belong to a symptomatic population. So if they really have some problem, you can give them, lianhua qingwen or some other herbs. You don't need to give them the ginseng formula, never, because the children, they have enough qi and they usually have some kind of heat in the body. So that's the reason you should not give ginseng to treat the children.
I have a personal question also. So
Sure.
the golden hour is less than 48 hours. Are you referring to the fever? So the fever should, we should administer ginseng immediately within 48 hours from having the fever.
Oh yeah. So very, very interesting question. So that another issue, because if you really have the detection of this COVID-19 virus, you should take it right away. But once you have fever, you need to increase your ginseng, because that means once you have fever, that means you will develop some symptoms, and you are the population belonging to the qi deficiency. So that's very important. So very important question. So then you need to increase your ginseng doses. Even you are young, but you still need to take a little bit more, the ginseng. Otherwise, you will not have any fever. So quite a lot of young people, they don't have any symptoms, right? I think in Philippines it should be same. So if you have fever, and if you're adult, you need to think about this medication. Maybe it not works, but it will protect your life. Because you don't know if you are really will develop a acute lung injury or not. It doesn't matter. I just want to use this medicine to save your life. It doesn't treat the influenza, but for the elderly population, we use it really, really work very well.
Can I have a follow-up question? So in Philippines, maybe the herbs are not readily available, but one possibility is, how about ginseng in powder form? It's the same, right? Herb powder, because you said like American ginseng is not what you use, so it's from Chiangpai-shan, then that's Korean ginseng, and but as long as it's from Chiangpai-shan mountain, and so I'm just asking, is the herb form ginseng also has the same effect?
No,
So I'm sorry, herb powder in powder form.
Oh, ginseng powder. Oh yeah. You can see in this original formula is a ginseng and manta formula. It's a ginseng and manta powder. So actually, in China we don't have this formula, but in Taiwan, mainland we don't have. But in Taiwan, in China, Taiwan, we have this ginseng and manta formula. You can buy it, I think from farmer store. I don't know if you have that. But ginseng powder is really also used very well. You can use ginseng powder, no problem.
Yeah, is there any additional question? So may I ask everybody turn on your camera? So later we should have the group pictures from the doctor. I think the Kadi, there's a question from Dr. Istrosia. Is Lensen Baidusan the formula used for the study, or Bison or Bison plus Boher?
Oh,
okay. That's, yeah.
So yeah, is Renshen Baidu San the formula used for the study? Yeah, we use it, clinically. We use that for the many practice, and we have been using this formula to treat different pandemic 1,000 years. You can read the Chinese medicine book, and you know this formula. You should find this very popular formula. Bison plus Bohr, not only Bohr. We use this. We call that 10 ingredients, 10 kinds of herb. You can find it, from the book. Korean ginseng have expiration. Yeah, Korean ginseng usually you should take it, within 10 years. But if you really have, I think if you have some kind of function, you can use that. But any herb, they all have some kind of expiration date.
Okay, so if there's no more question, there's the one question again from the doctor, A.T. Conception. Okay, in behalf of the CMIC Institute of the Traditional Chinese Medicine, and then I would like to congratulate the President of the Philippine Qihua Institute on the memorandum. Okay, thank you, Dr. A.T. Conception. Thank you, Dr. A.T. Conception. Thank you very much. Yes.
Thank you.
Okay. So, yeah, thank you very much, Dr. Li Guangxi. I still remember last year when the World Federation of Acupuncture Motivation Society have the lecture forum during the pandemic start in China, and then go around the world. And you gave the lecture. It's a very impressive, your lecture. Today the same, very informative, very impressive. Particularly, you're talking about the ginseng. I think this is what Chinese medicine also mentioned, the 扶正驱邪. How to support the healthy qi and to able to expel the evil from your body. So this is the really bring the Chinese medicine series to all of us. Thank you very much. I would like to present the certificate of appreciation to you from our Philippine TCM and Acupuncture Association.
Thank you.
This is the UFAS 2021 International Symposium on Acupuncture and Motivation. TCM Acupuncture Motivation contributes to building a global community of health for all. Certificate of appreciation. This certificate is given to Dr. Guangxi Li for sharing your, sorry, it's too small of the word, I cannot see from my computer. So this is from the Philippine TCM, Philippine Traditional Chinese Medicine and Acupuncture Association. To thank you for your support. Thank you very much.
Thank you.
We will send to you this one by the e-certificate. So I will ask everyone to turn on your camera so we're able to take a group picture. It's okay, everyone? Thank you very much.
Thank you. Now let us all turn on camera and we will take a
Yes.
screenshot. Please hold on for a minute.
Thank you. Thank you. Okay, so okay, Miss Liu.
Yeah, done.
We have
Yeah.
a 2 page. How about go to the second? Go to the second page.
Yes, I've taken the group photo. So, I think that's all for today's agenda. 杨老师在吗？
在。Can you
Okay.
hear me?
Yes.
Yes.
Okay, thank you. I almost lost of you. Okay, so thank you for all your participants, and thank you. We have the successful forum, and we hope in future time we will have another series of lectures and forums. And please keep your attention for our activities. Thank you so much. That's all for today. Is it okay for everyone?
Yeah. Thank you very much. Thank you.
Okay.
Thank you, everyone. Thank you,
Thank you
Miss
so much.
Liang.
Thank you, Dr. Zheng. Thank you, Professor Lee. Thank you all. Okay. Thank you. Bye.
Bye.
Thank you. Have a nice night. Bye-bye.
See you next time. Bye. Thank you.
Bye. Thank you.
Thank you so much.
谢谢郑会长，那我们就下期见了。
谢谢杨老师，谢谢杨秘书长，谢谢。
OK， 拜拜。
拜拜。
郑会长，您那边可以把今天那些问题，就是那些记录导出来吗？我看看我这里可不可以。
我看一下哈。
我这里好像也可以导。
你给它 copy 一下就可以了吧？
哦。